COVID has affected everybody. It's a pandemic, and much of the policy that's been created has been done on the fly. And in so doing, it's been drafted largely around the general population, leaving many parts of the population out, including the homeless. The shelters do not typically provide spacing for clients, and suddenly you have policy that says we must all be 6 feet apart. We have policy that says if you're tested for COVID, you need to isolate while you await your test result, but how does someone who's homeless do that? And so we realized that we had to answer these questions, and in so doing, we had to look and see how would we create a specific response to the homeless. And so that's what Main Street Project did. So this is 75 Martha. This is the principal low barrier shelter. As you can see, it's a small space. It averages about 2,000 square feet in total. We sleep people on 12 square foot mats, which is about the same size as a dining space that you would sit at a table. This is the average size of a bungalow in Winnipeg that sleeps 4, and we put about 100 in here. We shouldn't be here to begin with. COVID-19 has really sent that message loud and clear, and we can't return to this. We brought on a 72,000 square foot facility donated to us by a great philanthropist here in Winnipeg for use as a shelter space so that you can actually create 6 feet of distance between people in beds.
We've been here for roughly a month and a bit now. We decided to open not only sleep services, but do drop-in services in a socially distanced and responsible way on the first floor.
We have seen a dramatic increase to our female identifying population. We now feel they have a safe place to go because it's separate from the male population, and we've grown to about 175 folks a night staying with us.
Having more space available has really allowed us to connect one-on-one with clients so much better, to really engage with them about what's going on in their lives and for them to feel comfortable about where they're living.
This was all of the things that we've always wanted to do and wanted to realize manifested in a building. Our job now is to not only look at the reopening phases, but how do we sustain and advocate for this to be the new norm and the new norm going forward.
So this is our Main Street Project Shelter Isolation Building. When somebody comes here, they're greeted by our nursing team, who really has an intake process that is designed to best capture what a client needs to successfully isolate with us.
The shelter isolation site gives an opportunity for clients who are being screened for COVID-19, who are experiencing homelessness, to have a place to self-isolate and have their needs met while they're in isolation.
That successful isolation really encompasses addictions, mental health, and physical health. So the nurses will go through that process with them, get a sense of what they think they need to be able to be successfully isolated, and then orientate them to the space. Every suite has its own kitchenette, a microwave, coffee maker, fridge and stove, a TV, and a phone for people to connect back down with the staff.
They gave me some art supplies here, so I've just been trying to color and kind of writing in my journal a little bit. I think that it's really important that buildings like this are available at these times, because I'm sure I'm not the only one in this situation.
It really became a hybrid of housing with withdrawal management services, so 2 programs that we know a lot about and do, and blending those together in a model that never been put together before. The Mitchell Fabric Building was a longer-term project, a large multi-million-dollar complex a community health center for the homeless. There was a commitment of $2 million from the federal government towards that larger project. And in the time of COVID, we were asked by the federal government, could we do something in a more responsive way to bring on more space for people?
So we see this as a phased approach, this being phase 1, the emergency renovation, in order for us to react appropriately to COVID. As soon as we get ahead of ourselves a little bit, we'll go back to the original project, the Community Health Center for the Homeless, and we'll enter into phase 2. It means safe sleeping space, it means adequately spaced sleeping space, it means dignity, it means better access to supports, and we don't foresee going back to the way that we were before. We're not going back to our old shelter. This is where we're going to be, and being spaced out and having adequate resources is how we foresee the future.
Ultimately, if you want to end homelessness, which is what we're all about, you need to provide people dignified space, and you need to provide them an environment where they can heal and recover. If you don't do that, you perpetuate what you're trying to get rid of. For the first time, we've turned the corner and we've changed that. We've actually changed the entire model without knowing it. So the question is, can we understand that? And can we realize how that model contributes to the healthy healing of people so that we can move on from homelessness? Giving people dignified space is a first step, and that really costs nothing.